What is up, everybody? Jimmy McCann from the RT Clinic. This is the SINODA device. You have your patient on non-rebreather and maybe they need a nebulizer. But we know that with a nebulizer, they're only going to get about 40 to 60% FiO2. And if they're on a non-rebreather, there's a reason for it. It's usually because they're requiring 80% or higher. So in this case, you're going to see I can run a nebulizer and a non-rebreather at the same time. And you see one of the nice things with this is that you're going to be delivering near that non-rebreather FiO2, but then also giving the nebulizer to the patient. So this is a really neat adapter. It actually comes apart in 3 pieces, and all of these kind of interchange with each other. I feel like an RT just took the pieces and made it exactly the way it needed to be. So these actually go and they interlock, so it can go in many different configurations. One nice configuration is this one here, where it has a downward angle for those patients that you need to get that nebulizer at the correct angle or the oxygen at the correct angle, so that this can run, stay vertical, and you give them the entire amount of the nebulized medication that they need. Sometimes this nebulized medication is something that's going to open them up to require less oxygen, but in the meantime, we need to give them oxygen during this. That's the beauty of this. And there's 3 different pieces to the SINODA, and you got multiple different ways that you can connect these to make it best to deliver your medication and your oxygen at the same time. And it connects to all these different masks, including a trach mask. Adapt the SINODA in and give your patient oxygen and the nebulizer at the same time. One great thing that I feel is a great safety mechanism with this device is the fact that if for some reason you get called out of the room and your nebulizer runs out or something happens, they're still receiving oxygen through the nebulizer, but they're getting the non-rebreather. Without it, if this patient required high FiO2s, which a lot of our patients do, they would have a nebulizer running. If the nebulizer runs out, I get called out for an emergency and I can't get a nurse in here in time, then the patient's sitting on 40 to 60% of oxygen through a nebulizer that's empty. Whereas with the SINODA, you got that backup where they're still on their 100% oxygen. So if I get called away in a hurry, I can't get anybody in the room, I'll know that they're still going to be on the right amount of FiO2, not going to desaturate while I'm out of the room. It's not only really nice for RTs, but I do think it's a very good patient safety mechanism to be able to have oxygen delivery at all times, even during the nebulizer treatment. Not only does the SINODA work for non-rebreather and nebulizer, it also works for our Venturi mask, one of my favorites. This is the thing we can deliver exact FiO2 to our patient. So simply hook up this. Since it's specifically made, the inner diameter fits this, the outer diameter fits a piece of corrugated tubing. Now we have 50% oxygen and our nebulizer running. So how easy is it to use? Simply 3 adapters inside this package, and inside of it you also have the configurations that you can use. Really nice for respiratory therapists to have, so I can see all the configurations that I could possibly use with this device, including using Venturi masks, double nebulizers, actually hooking 2 nebulizers into this, using a non-rebreather and a nebulizer, and all those different configurations come with each one of these setups from the SINODA. The SINODA is not only a device designed by RTs for RTs, it's cost effective, easy to use, and it adds that extra layer of safety that all of our patients deserve. Pick one up today.